Hey everyone, and welcome back to my channel. Today we're diving into the world of blood clots and a natural supplement called nattokinase. You might have seen headlines claiming it melts blood clots, but is there any truth to that? Let's separate fact from fiction and explore the science behind nattokinase. But before that, hit the subscribe button and bell icon if you want more health-related updates. What are blood clots? Our bodies are pretty smart. Blood clots, like tiny stoppers, form to seal up wounds and prevent excessive bleeding. But sometimes unwanted clots show up uninvited inside blood vessels. These can be dangerous, especially in the legs, especially deep vein thrombosis, DVT. If a DVT clot breaks free, it could travel to the lungs, pulmonary embolism, causing serious problems. That's why healthy blood flow is important. Causes of unwanted blood clots. You know, there are several factors that can increase your risk of developing blood clots even when you're not injured. These include inactivity. Sitting or lying down for extended periods, such as during a long flight or after surgery, can slow blood flow and increase the risk of clotting, especially in the legs, deep vein thrombosis. Certain medical conditions, inflammatory conditions, chronic diseases like cancer, and hormonal therapy can increase your risk of clotting. Surgery. Trauma to blood vessels during surgery can trigger clot formation. Damage to blood vessel walls. Conditions like atherosclerosis, which hardens and narrows arteries, can damage the inner lining of blood vessels and increase the risk of clots. Genetics. Some people have inherited conditions that make them more prone to blood clotting. Understanding nattokinase. Nattokinase is a type of enzyme present in natto, a classic Japanese food prepared from fermented soybeans. Additionally, it is marketed as a dietary supplement to support heart health. Although nattokinase side effects are usually minimal, bleeding risk may rise. Bacillus subtilis natto converts soybeans into natto. Natto is a nutrient-dense food with zinc, calcium, copper, iron, magnesium, and potassium. The alleged heart-related advantages of nattokinase are thought to arise from an increase in the body's natural production of tissue plasminogen activator, TPA, and urokinase. One of the structural elements, parts of blood clots, fibrin, may also be directly broken down by nattokinase. So, can nattokinase melt blood clots? Nattokinase, an enzyme found in the fermented Japanese food natto, has gained popularity as a dietary supplement, claiming to prevent and treat cardiovascular disease, particularly by dissolving blood clots. However, a closer look reveals a story filled with more hype than scientific backing. Nattokinase can help in patients suffering from thrombosis, that is a formation of blood clots in the blood vessels. Thus, it breaks down fibrin and reduces the concentration of hemostasis factors that cause blood clotting. A high nattokinase dosage is a good anti-clotting agent that can reduce blood clots and probably prevent them from forming. In a nutshell, that means it is similar to aspirin, the most widely used blood thinner. Nattokinase is capable of ensuring normal blood circulation too. Any blood clot in a person's body's deep vein is known as a deep vein thrombosis, DVT. It is most often found in the legs and frequently affects older or obese people who suffer from some other type of circulatory problem. Studies have confirmed that nattokinase destroys fibrin and acts as a powerful blood thinner, reducing the concentration of factor VIII, a blood-clotting protein. In an article published in the International Journal of Molecular Science, 12 healthy young male subjects were selected by chance and given one tablet of nattokinase 2000 FU, which stands for fibrin units. Within 2 hours, a significant increase in their antithrombin concentration was observed. Accordingly, it is revealed that it works by increasing blood flow and thereby preventing the formation of blood clots. During the research, dogs were given 4 NK capsules orally 2000 FU per capsule. Normal blood flow was restored in 5 hours, and the chemically induced thrombi in the major leg vein was completely dissolved. Furthermore, it also showed that mice treated with NK restored 62% of arterial blood flow. Other possible nattokinase benefits. There are many benefits of nattokinase. Some of these are hypertension. Studies have shown that nattokinase may lower hypertension, often known as high blood pressure, by inhibiting the angiotensin-converting enzyme, which helps in narrowing blood vessels. It works well to lower blood pressure at both the systolic and diastolic levels. Alzheimer's disease, AD, and other amyloid-related disorders. Natokinase has neuroprotective effectiveness partly because of its anti-inflammatory and anti-apoptotic properties. It also regulates some risk factors of AD, including acetylcholinesterase, TGF-B, and FAs. It improves memory impairment and breaks down amyloid fibrils, which are protein clumps. High cholesterol. The natokinase reduces serum cholesterol, LDL cholesterol, and HDL cholesterol to effectively address high cholesterol. How is natokinase beneficial during inflammation and pain? If you are suffering from systemic inflammation, which exacerbates inflammation, you run a larger risk of coagulation abnormalities, such as thrombosis. Natokinase has antioxidative stress and anti-inflammatory properties in addition to its antithrombotic properties. It keeps C-reactive protein, a marker of inflammation and a heart disease risk factor, at healthy levels. Two major factors that contribute to inflammation are oxidative stress and inflammation. Natokinase inhibits this process, reducing LPS-activated macrophage, an immune system cell that signals and guards against LPS-stimulated pro-inflammatory cytokine production and blood clots, interrupts the vicious loop between inflammation, oxidative stress, and thrombosis. Stated differently, it inhibits the production of pro-inflammatory mediators, hence mitigating inflammation and discomfort. How much natokinase should be taken? There are several dosing forms for natokinase, with capsules perhaps being the most popular. Larger, more well-planned trials are required, even if there are a few brief, tiny investigations on natokinase. As a result, there are no recommendations about the right dose for any given illness. Notify your healthcare professionals and pharmacists of any changes to your drug regimen in order to use natural medicines, including natokinase, safely. This covers over-the-counter, OTC, herbal, and natural supplements as well as pharmaceuticals. In terms of dosage, the following observations have been made. At 2000 FU, or around 100 milligrams, the most typical benefits are seen in antithrombic and cardiovascular effects. Serum triglycerides, total cholesterol, and LDL cholesterol, LDL-C, are all reduced after 8 weeks of 4000 FU treatment. 4 hours after natokinase was administered, there was a significant rise in blood fibrinogen degradation products, thrombolysis, and anticoagulation profile, following a single dosage of 2000 FU. Atherosclerosis can be effectively stopped from progressing by using 6,500 FU for 26 weeks. It's best to talk to your doctor before taking any new medication or supplement. Sources of natokinase and what to look for. Now that you know about natokiase, let's have a look at some of its sources. There are several types of sources of natokinase. Food sources of natokinase. So we know that natto, a typical Japanese dish, is made from fermented soybeans and contains an enzyme, protein, called natokinase. Bacillus subtilis is a bacteria involved in the fermentation process. Natokinase supplements. There are several different forms of natokinase available, such as pills and capsules. There may be several dose forms of natokinase available, such powder if you have trouble swallowing tablets. Vegetarian and vegan choices could also be available. Your choice of product will be determined by your desired outcomes and preferences. The way each product functions varies based on its shape. Thus, it's critical to heed the advice of your healthcare practitioner and any label instructions. Side effects of natokinase. Now let's have a look at some of the side effects of natokinase. Human trials have not yet shown any unfavorable side effects. Thus, using the enzyme is usually safe. Nevertheless, because natokinase might affect blood flow, a safety profile for this medication is still required. Be aware of the following natokinase-related issues. It could make bleeding disorders sufferers, like those with hemophilia, more symptomatic. For those using aspirin or warfarin as part of a blood thinner treatment, it may exacerbate bleeding and make bruises more easily. When using natokinase, those who have hypotension, low blood pressure, may feel lightheaded, dizzy, or have headaches. It could cause hypotension and exacerbate the effects of some antihypertensive medications, such calcium channel blockers and ACE inhibitors. To reduce the risk of severe bleeding, anybody scheduled for surgery should cease taking natokinase at least 2 weeks before the procedure. Pregnant or nursing women should not use the enzyme because there is insufficient information on its usage in these populations. We don't know the long-term consequences of natokinase or the effects of acute toxicity, genotoxicity, or repeated doses. Before using natokinase supplements, speak with your physician to minimize the risk of side effects and undesirable interactions. So there you have it all, my lovely health enthusiasts. This was all the information that you needed about natokinase. This video covered natokinase, its potential benefits, and its limitations. In conclusion, natokinase, an enzyme found in natto, a fermented soybean dish, has gained popularity as a supplement for heart health. Before you start consuming natokinase, it is important to consult your doctor, especially if you have any underlying health conditions or are already taking medications. There are other well-established methods to help prevent blood clots, so focus on those first and discuss natokinase with your doctor as a potential complementary approach. Thanks for joining me today. If you have any concerns about blood clots, please consult your healthcare provider. Let me know in the comments below if you have any questions, and I'll do my best to answer them. Don't forget to like and subscribe for more health-related content.